to be back. Today I'm just going to be doing a quick lecture on extraoral and intraoral exams. Mainly going to focus on the importance of them, and then I will be showing you guys a short video of a demonstration of one that's pretty similar to the worksheet that we gave you here and what's needed in clinic at your school here. And then as well as I'll be doing a demo in the chair also on a student, so you can kind of see it hands-on first before you guys get into the clinic. A little bit about myself. I actually went to the hygiene program here as well. I graduated in 2011. So super proud of you guys, and you guys should be proud of yourselves because I know it's really hard to get here, and this is a really stressful quarter. But if you can get through this quarter, you can get through it all, because this is definitely the most. You'll have so many exams, as you all know, but it gets better and it is so worth it when you're done. I'm actually a full-time dental hygienist now in Bellevue, just sneaking away for a couple hours, but I work Monday through Thursday, which is great, so that's one of the perks of being a hygienist. Your schedule's pretty flexible and the hours are great. And currently I am working full-time and earning my bachelor's degree through OIT, which is the Oregon Institute of Technology. I believe Miss Davis earned her master's degree, bachelor's through OIT. It's a great program. I listed a few reasons why I chose OIT over Eastern. Just because you actually have 7 years to complete your bachelor's degree, but it seems like a long time. So you have a lot more flexibility, where in the Eastern one it's a 2-year course, I think, straight through. And you actually get to choose the courses you want to take. So I get to choose that I want to take this class. This is an instructional methods class, and I really want to be a clinical instructor one day, so that's why I chose to take this class. So you really get a diverse range of classes that you get to take. It's all online, so you don't have to attend class, which is nice. So you can do it at night when I get off work at 5. I can go home and do a couple hours of homework or do it on the weekends. And it's not too intense, and it's very manageable with working full-time. Because like I said, you can take 1 class a quarter, or you can take 3 classes a quarter. You can take 2 quarters off in a row, and you're still a student. So you have 7 years to complete the degree. So I actually take 2 classes fall and winter quarter because the weather's not as good, and then spring and summer I only take 1, so I can do more fun things outside. But just a quick advice as a hygienist now: make sure to take care of yourselves. Like we talked about, it's super stressful, but really take care of your body. The instructors have probably told that it is really hard on your body, and it is. So try to exercise regularly. I know it seems impossible right now. Eat really well and get enough sleep. So today, the course objectives, it's going to just be a quick PowerPoint, and then we're going to do kind of some more fun activities to get you guys involved. But by the end of the lecture, you should be able to perform a pretty basic extraoral exam on each other and be able to point out all the different things that you're looking for. And like Ms. Davis said, you guys will be doing this more hands-on in the clinic both Thursday and Friday, so you guys will learn it really well in clinic. Given the veloscope, which is a different aid in kind of helping identifying oral cancer in the mouth, you guys will be able to correctly identify which pictures are known as like normal structures, or if something in the mouth is more abnormal and we should be more concerned about it, whether it's cancerous or not. You guys will be able to list the ABCDs when identifying different lesions or structures in the mouth. And you also will be able to learn which areas of the mouth need to be palpated. So you, doing your extraoral and intraoral exams, you will not only visually be inspecting things, but you will physically be palpating areas to look for any different lumps and bumps, which is a very important part of the exam. I am going to show a short video so you guys will kind of learn the sequence of the video, but we actually will go off the sequence of the handout, the EOIO, because this is what's expected in clinic, and this is a really good handout because this is actually what I used when I first graduated and did it on my own. So this is a good thing. I still have all my stuff from hygiene school. But and then at the end, after we do a little activity in small groups, I'm going to ask for some volunteers for people to describe certain things and see how well you guys learned today. So first I'm just going to show a short video. It's a few minutes long. The first video part is going to be kind of sideways because she doesn't sit down doing the extraoral exam. But once the student sits down and does the intraoral exam, the picture future we'll kind of go more regularly so you guys can see better. But
in this instructional video, we will demonstrate how to perform the proper technique of the extra and intraoral examination.
sorry, it's sideways. I had to
Observe
find one
patient
that
upon
best
reception.
represents the actual exams that you guys will be
Visual
doing.
examination will include the extraoral tissues to include forehead, eyes, cheek, nose, lips, and neck. Palpation examination, the clinician will don examination gloves. Start with the bilateral palpation of the submental area, submandibular area, pre-auricular nodes, post-auricular nodes, occipital nodes, the anterior and posterior chain of the cervical lymph nodes along the sternocleidomastoid mastoid muscle, right side and left side. And lastly, the supraclavicular node. And the thyroid gland, you're going to ask the patient to swallow. TMJ, ask the patient to open and close. And parotid gland, have the patient clench their teeth. You will now wash or sanitize your hand and put on new gloves.
So this is a really important step, how she's degloving and regloving before you go back into the mouth when you wear makeup. And you just don't want to touch people's outer surfaces of their face and then use the same gloves going into the
Bring the patient back
So
in the
this is
chair.
really important to
You're going
switch
to do a
gloves.
visual examination. Observe the labial mucosa, the upper lip, and the lower lip. Buccal mucosa, right side and left side. Palate, hard and soft. The tonsillar area, posterior pharynx, patient says ah. The tongue and the floor of the mouth. Palpating now the labial tissues, upper lip and lower lip. Clinician will retract the lips with the index finger and the thumb of one hand. The buccal mucosa by manually index finger and middle finger of the opposite hand, right side and left side. For the palate, you're going to use your index finger, the hard and the soft palate. Inspection of the tongue, we'll use gauze to grasp the tongue, check the lateral borders, and we'll palpate each side. Dorsum and ventral surfaces, posterior middle third. The floor of the mouth, by manually, the clinician will instruct the patient to raise the tongue, and you're going to palpate posteriorly to anteriorly. That concludes our extra and intraoral exam.
Okay, so that was just a quick video of kind of what you guys will be learning today in the lecture and mostly tomorrow into the lab when you guys really get hands-on. So it seems like a lot at first, but you'll get to the point where you can actually just do it really smoothly and thoroughly and kind of know the order of everything. So when looking at these pictures, we don't really expect you guys to know, but just take a few moments and kind of examine them. They're both on the left side. The first picture on the left is an older gentleman's lower left lip, and this is the left mandibular vestibule by the molar area. Take a quick look at those and think to yourself whether you think they're benign, meaning non-cancerous, or malignant as cancerous. And by a show of hands, who thinks they are both benign or non-cancerous? Be brave. Good. Who thinks they are malignant or cancerous, both of them? Who thinks there is one of each? Who has no idea? Okay. So they're actually both malignant, so they are both cancerous. The first one is what's known as squamous cell carcinoma, so it's a very aggressive form of cancer on someone's lip. And the second one was leukoplakia, which is also a form of aggressive. My guess is that person probably chewed that I could be wrong. But the importance of that is not to be able to identify, especially at this point, exactly what it is, but more so to recognize that that was not something that you would normally see on an individual when they come in to get their teeth cleaned, per se. So to be a good clinician, it's mainly just recognizing what is normal, both on a person's face and neck, and intraorally. So then if something does not appear normal, you can guess that it is abnormal. And then you can further treat the patient, whether you think it's something you just monitor or refer out. So some basic quick facts about oral cancer. Luckily, it only accounts for 2 to 4% of the cancer in the United States, which is great. That doesn't seem like a lot. Unfortunately, it occurs 2 times more in males than it does females. And as we can all conclude, the use of tobacco or smokeless tobacco products does account for 75% of oral cancers in the mouth. So just because your patient does not smoke or does not chew or never has, does not eliminate them from ever getting oral cancer, but it definitely increases their risk of getting oral cancer. And this is really important. The 3 most common areas you will find oral cancer is the tongue, usually on the lateral borders or underneath the tongue, the palate, and then the cheeks or the buccal mucosa. So those are areas that you really want to examine well each time. Some quick signs and symptoms of cancer is anything that looks red, white, or especially a mixture of both. So if you see a lesion and it's somewhat white and somewhat red, that's definitely a suspicious area. If a person has a lump or thickening or bump in the mouth, tongue, or the throat that does not go away, and that's why we really emphasize palpating pupils, because you may not be able to visually see it, but if you can physically feel it, then you can detect it early, which is great. Also, if a person has a sore that does not go away easily, so they come in and they say, oh, it's been there for a month or 2 or 3 months, or I've had it for the last year, I've had it so long I don't remember, or if it bleeds easily, those are all other signs that it could be a suspicious lesion. Or even if it gets to the point where the patient has difficulty chewing or swallowing. So this is the important, we're going to talk about the importance of extraoral and intraoral exams, which I find very interesting because as a clinician today, I can honestly say I have done a thorough extraoral and intraoral exam on every single one of my patients that I've cleaned their teeth. So it should not matter how far behind you're running with your patient or anything. When you get to be doing this, you will be able to do a quick, thorough extraoral and intraoral exam, and it is really, really important because you can save a person's life by detecting this. And I was talking to some students before, and one of the gals was like, yeah, I've never even had this done before. So not all dental offices are doing it, and most physicians don't do it. So make it your responsibility to take pride in your patient and make sure you're treating them with the exams. So doing this, it provides a total assessment prior to treatment. So you don't really want to look at your patient as just, oh, they're coming in, you're getting their, you're cleaning their teeth and getting them out of the chair. It's really learning the health and the overall health of your patient. That's why we have to do the medical histories. That's why we want to know all the medications. So you want to know your patient as a whole so you can better treat them. And then if any follow-up is needed, then you can do that. it's really important to do these exams because, like I said, you can detect cancer lesions early, and like with any cancer, the earlier you find it, the better the prognosis, because oral cancer is not very common. As we heard, it only accounts for 2 to 4%, but it is pretty aggressive, so it can grow and spread quickly, so the earlier you find it, the better. And like I said, we kind of are the main method for controlling and even identifying oral cancer. So even if it's not, you know, a priority of the dentist that you work for one day, make it your priority that you look at all of your patients to help them. Because most oral cancer is asymptomatic, so patients will come in, they will not have any signs and symptoms, they'll say everything feels great, it looks great, but little did we know that we took the 2 minutes to do the exam and found something. More important things of the exam, like I said, it could save somebody's life. I have only been in the field a little over 2 years, and I have sent several people to the oral surgeon, and 2 of them have been cancerous. So they are very grateful. They're very scared at first, but they are very grateful when you're able to find something and you take the initiative to refer them and get them treatment and help them, because it can save their life. So like I said, make it your standard of care. So just take pride in your work and take pride in your patient and treat them. I always think, you know, treat every patient as if it was your parents or your grandparents, and you would be really bummed if you knew your grandma went down the road and had a teeth cleaning and they didn't do a 2-minute exam and you found out she had full-blown oral cancer with a big lesion in her mouth that they could have easily seen. And oral tissues are great indicators. So sometimes people will have different conditions going on in their mouth and or in their body, and actually one of the first signs you will see as a hygienist is signs will show up intraorally. You'll learn kind of more of this in pathology. You'll learn about different chronic illnesses and diseases, like for instance, patients suffering from HIV and AIDS, they have a lot of oral indicators that there's a lot of breakdown and disease process going on. And then, like we said, really recognizing the normal between abnormal, because if you know what normal is, if it doesn't look normal, then it's abnormal, and then you can kind of take the steps to further prepare that patient for any treatment that they may need. So when we're talking about normal and abnormal, there are many different structures that you guys will learn from here on out in hygiene school. And so some common structures that you guys will see a lot of the time are exostoses, which is bony protuberances in the mandible and maxilla, and you guys will all learn about these terms. But these are all normal things that you will see on a day-to-day basis being a clinician. You will also see macules or nevi, so people have freckles and moles in their face like I do. People will have tori, which is bony protuberances. They're most commonly found on the palate, or lingual tori underneath the tongue. You guys will probably find them on each other tomorrow when you're doing the exams. Linea alba, which is the picture to the right, that's pretty much seen on every patient, and petechiae. But when we're talking about abnormal structures or things we will find in the mouth, it doesn't always indicate that they are cancerous. So that's something to keep in mind. Just because something's not normal does not mean the patient has cancer. It's just something that you want to monitor and follow up with. So for instance, nicotine stomatitis. So if someone smokes and they're inhaling the cigarette and the heat, it causes these little red and white kind of places on their palate, most commonly your soft palate, and you'll see that if you have a patient that smokes. Just because they have that doesn't mean they have oral cancer. Geographic tongue, you will see a lot of this. I was surprised at how much I saw of that. Black hairy tongue, and you'll learn about a lot of this in pathology, which is statistics as well, which is one of the best classes ever. And also irritational fibroma, which is this picture here. So if someone has like a chronic habit of like chewing on their lip or chewing on their cheeks or something, you actually can get to the point where you actually cause like a little callus fibroma that kind of sits there. And many people leave them there, or many people eventually get them excised or taken off. So when we are performing the exam, you guys have these worksheets. Really take pride in these worksheets and use it as kind of a cheat sheet, because this is really what's expected in clinic to do well, to to make sure you're looking over everything, but it also is a guideline so you make sure you cover all your bases, because you'd hate to miss an area and then your instructor comes through and you find something, or you miss an area and then the dentist comes in to check, when you're out in the real world, and they're like, oh, well, why didn't you see this? And it's like, I forgot to look there. So this just really covers your bases. It also increases your efficiency, so you'll more than likely find everything you need to, and it just maintains a professional relationship between you and the patient. Some of you at first may feel slightly uncomfortable doing the exam on each other or on patients, but the more you do it, the more familiar and comfortable you'll get, and you'll get to the point where you're super confident. And my patients know that is the first thing I'm going to do to them the second I lean them back in the chair. And I think that's good, because then when your patients expect it, if for some reason I didn't do it, they'd probably be like, why are you not doing that? Because they really take pride in that you're doing that, because a lot of the patients, when they come in, they'll be like, oh, what are you doing? So I always say, okay, well, I'm going to go ahead and I'm going to do the extraoral and intraoral exam. This is the oral cancer screening we do each time you come in, because every single time a patient is seen in my office, we do this. Yeah, so we'll be referring to this handout for all the structures that we need to do. And eventually, these will be laminated, I believe, because you guys will use them in clinic with your little pens, and you'll write on them, and then you'll transfer that into the computer. So this is exactly what you'll be looking for on your patients. I call it the little cheat sheet, because it tells you everything you need to know. Don't be embarrassed to use this, to have this right on your counter right next to you, and just fill it in as you go. So very common to do that. You always want to start with the extraoral exam, just like the girl did in the video. You want to do everything extraorally first, and then make sure to deglove, and then do the intraoral exam. And just, it's a nice sequence that Ms. Davis has put on this handout, kind of the order to do things in, because it kind of flows from one area to the other, and the more you do it, the more you'll get used to it, and it'll get to the point where you don't need the sheet, and you'll just memorize it. Like, I can sit in the chair and do an extraoral and intraoral exam really quick, and I just have my order that I do it in. So it will become memorized, and it will be really easy for you guys one day. But for now, when you're learning, just make sure to follow the sequence, so you make sure that you look at all the different structures, especially because they ask for specific things, like they want to know the shape of someone's palate, if they have any tori, so the bony protuberances, the size of them, if someone has any crepitus, in the jaw joint. So those are all things that you'll be identifying on your worksheet. So, what happens if we're doing the exam and we actually find something? Like, for instance, a couple pictures ago, that little irritational fibroma on someone's cheek. How would you describe that? So, think of the ABCs. If you were to find something in the mouth, just always think of the alphabet. You'll always use the A, B, C, D, and sometimes E if you need to. And I'll also talk later about the location is also very important. So the A stands for asymmetry. So when you find a lesion, you really want to look for if it's symmetrical from one side to the other. If it is, it's usually not as suspicious, but if one side is very different from the other side, then that usually is a sign that it is something that's more suspicious. Borders, you want to look for irregular borders, because when something's not perfectly round and it's more jig-jagged, that's more of a sign of that something's suspicious or could be cancerous. You want to look for any color, but mainly like we talked about, anything that's red, white, or a mixture of both of them is usually a pretty aggressive form. And also the diameter of things. So it's really important to measure things that you find intraorally. So you want to measure the length, the width, and then if there is height or the elevation, you do want to measure that as well, and you'll use your periodontal probe to do that. So I am going to do a quick demonstration actually, so you guys can kind of be more hands-on and look over me. If someone would like to volunteer, I'm going to do it over in the chair, and then we'll actually bring the paper over, and you guys can kind of huddle around, and we can actually just go through this exact sequence so you guys kind of know more exactly how it will be in clinic. So, who would like to be the... Okay, perfect. And your name?
Jazzy.
Jazzy? Okay. Come on up. And if you guys want to huddle around, you can, so that's what we'll find.